the hemophilia A in particular, these patients can't clot easily. They're missing a blood protein that is necessary in the clotting cascade called factor VIII. And about 30% of severe hemophilia patients have developed these inhibitory antibodies, so the factor VIII replacement therapy. So they're left with very few treatment options. All have really side effect profiles. They're expensive. They can lead to thrombosis. And so we really looked at, okay, well, is there an easy way to make factor VIII, which is already FDA approved, efficacious for these patients? And so that's what really spurred us to look at microencapsulation of factor VIII for hemophilia with inhibitory antibodies. Once the microcapsule is injected into the patient's circulatory system, the patient's own platelets actually bind to the microcapsule, and this is through some fibrinogen we've displayed on the surface of the microcapsule. And once the microcapsule has flown into an area of clotting, active bleeding, the platelets tend to activate, and this is something that's naturally occurring in their own function in clot regulation. And so this is a biochemical process. And it's also a little bit shear dependent, but mostly biochemical. And so they adhere to the site of injury. And then further along in the clotting cascade, clot formation, the platelets actually start to physically contract like a muscle on that clot. And so that's what we mean by biomechanical. It's a mechanical force. That contraction of the platelet ruptures the particle open and delivers factor VIII to the site of injury. So I spent a lot of time in a confocal microscope room. We're basically making these fibrin platelet clots and just looking at how platelets, one, adhere to the microcapsules, because that's the first step, and then two, once they begin to contract when they're exposed to certain activators. Do we A, see deformation on the microcapsule, and then two, do we see delivery of something that we floated inside the microcapsule outside the microcapsule? And we've seen both, and that's how we've confirmed this mechanism on the microscale. And then of course, when we look at bulk clotting, we've confirmed that through just clot formation, just a visual-based assay. So we have a couple more in vitro experiments further looking at platelet function in the system. And then once we've done those, we will be moving into hemophilia engineered mice and looking at efficacy as well as safety of the microcapsule system.